Welcome back. Joining me now, Nick Alba, the Amatus Health Director, and UMBC's right here, Dr. Carlo DiClemente. Doc, I'm going to get to you in a second, but tell us about Amatus, and you guys are a recovery system nationwide, right?
Correct. Yeah, so Amatus...
Is anything working?
A strong continuum of care with a multidisciplinary approach is, in my opinion, and I'm sure Amatus's full opinion, that is the best recipe right now.
How much is enough? How much is a strong? You mentioned strong. Is it 30 days? Is it 60 days? Is it 90 days? Is it longer?
We're talking longer. We're talking up to a year and a half, 2 years, starting from getting them off the drugs in an inpatient setting, all the way down to, twice a week in outpatient and anything in between.
How do you get someone to stay a year in a treatment center?
It comes down to the motivation, right? So myself, I'm in recovery. I've been in recovery for over 10 years. Mm-hmm. When I was 19 years old, I was arrested for the last time, and I just said I had enough. And the judge was grateful enough to give me a chance and send me to treatment. All
right, doctor, tell me what you see on campuses like this.
So I think a variety of problems on campuses like this, like you were saying with your son, the non-prescription use of prescription medications, people are using study drugs, they're using a variety of drugs to...
When you say that, you're talking about Ritalin and the others?
Right. Buying some of the
Adderall
and the Ritalin and some of the drugs that are used that way. Anxiety drugs.
What are Ritalin and Adderall really? I mean, a lot of people say it's for kids with attention disorder, deficit disorder to be able to focus and study, but isn't it more like it's an upper?
It's speed. It's really kind of a medication that actually gives you a little bit of a bump, and it does help focus. So that's the parts of it that you really want for ADD or ADHD. It does help people focus and to calm down and to do a little bit more planning. For people who don't have ADHD, it's much more of just an upper that allows you to kind of focus, stay awake a little more, be a little more engaged in your activities. But there's a payment, so you crash afterwards. And that's really the biggest problem, is that you can do that for a while, but you can't do that for very long.
Nick, what are you seeing, again, is it heroin, is it opioids, the most addictive substances that you're finding?
It's opioids, definitely, and not just heroin, but fentanyl, prescription opiates, the whole entire class of that drug.
What's the hardest behavior to break?
The lifestyle and the rush and the feelings that someone get when they use it. And like they spoke about before, the drug dealer that kills a person from an OD becomes the most popular because that's what people are looking for.
Tell me this: you have, let's say, an 18-year-old son or daughter who's a great student. He or she does not want to go into recovery, and you think there's a problem there. How do you get that person into a recovery system? You need a court order, right? A doctor and a parent signing off on putting someone who's an adult into recovery. Yes.
You could get a petition to have them put into. It's more for mental health, but you could have a petition to have them put into some sort of treatment. In the state of Maryland, they don't necessarily have a petition to put someone into substance abuse treatment if they're over the age of 18.
Gotcha. Doctor, your thoughts on that?
So I think, we really have to work on the motivation. So I do think that there's a lot of other strategies. So we talk about the community reinforcement approach, teaching families how to kind of engage their individual, how to bring them into treatment, how to kind of talk about with other professionals about the dangers and what's going on with that particular individual. If a family's seeing it, it probably is a little worse than they really think. Because normally you can hide a certain amount of this. When people start recognizing and seeing some of the things, then they begin to realize that there's a problem.
Can you tell our audience about Naloxone or Narcan?
Sure. I mean, I think that because we are dealing with people who are addicted, and when you have an addiction, it changes the brain. It changes the way people function. It changes the pleasure and stress mechanisms in the brain. It reduces their self-regulation, and it takes over their lives. So people do things. We're doing a project with pregnant women, and it was really interesting to hear the woman talk about, I tried to get off when I was pregnant because I wanted to protect my baby. And then after a while, I just couldn't do it. So there's a sense that there's a loss of control. And so when that's happening, it's very difficult for the individual to make good choices. So that's where you need the support, you really need the structure, and you need to do harm reduction. So this person who's not making good choices, you want to have them at least alive for another chance. So that's really what you want to do with the Narcan.
Nick, talk to us a little bit about this. And again, I'm doing this for the audience to understand. If you go into recovery, a lot of people, a lot of addicts or people who are suffering, when they leave recovery, they die because their body is not used to doing the same amount of drugs that they did on the way into recovery. Is there a way to follow these people, make sure they're not jumping back into the levels that they were prior to coming into recovery?
Of course, and that comes with general follow-up and calling them, twice a week or once a month after a while and checking in on them and seeing how they're doing. A lot of our treatment facilities and other treatment facilities offer alumni support once a week and family support in order to, like he said, the community integration and bringing everybody together, because it's not just the person who's suffering, as you know, it's the family as well.
Don't I know? A sponsor, in AA there's a sponsor, where if a person feels like they're going to take a drink when they shouldn't, they call the sponsor and the sponsor says, stop, I'll come help you.
Right.
Is there anything like that with drugs?
Yes. So there's 12-step programs, along with Alcoholics Anonymous, that look at the drugs as well, because that's becoming more prevalent over the years. And being in recovery, it's not just the alcohol, it's not just the drugs, it's the disease, right? So there's a lot of things coming out about gambling addiction, about sex addiction, about video games. Being addicted to video games is the brain disease that's coming out now. It's not just the drugs.
Doctor, this is an important topic. I think a lot of people have been doing recent studies on what is triggering the addiction. Is it our cell phone? Is it our constant need to look at something, get support, and get more views or more tweets or more retweets that gives us pleasure zones that resonate? And if we don't get it here, we're going to do it by taking something?
So I do think that behind some of this is what I call kind of a crisis of meaning. I think that for the addicted individual who is kind of searching for the high, they're searching for something. And I don't think it's the high, because basically what happens with addiction is the high wears off, and you don't get, your people who begin are not, for the certain reasons of getting high, are not the reasons that they actually continue. They continue to avoid withdrawal. They continue to feel normal. They continue to kind of have a sense that, and why they're looking for this next high, why they'll buy something that killed somebody else, is because they're not wanting to be just normal. They want to be more than normal. They want to have that, they want to recapture that high, just like people in gambling want to recapture the win.
That's why they're using the fentanyl. Very quickly, is marijuana a gateway drug to harder drugs?
In my belief, yes, it is. It is. And not only just because of the feeling that you're chasing, but along with that, it's the people that you're surrounding yourself with, right? So for myself, in my personal story, marijuana was the first thing I did with the group of friends that I started to hang out with. And they were the ones who introduced me to the other drugs, the harder drugs, that got me to where I was when I was 19.
You see this in recovery too?
All the time.
That marijuana was the gateway. It's a causation, not just a coincidence?
It's very rare that you see someone who the first drug they ever did was heroin.
What do you think, Doc?
So I've actually done a lot of smoking research. So smoking was considered the gateway drug a long time ago, that it was tobacco that got in. And we've done some work looking at Maryland teenagers and looking at what they do. Many of them, if you start using, the big issue is if you get past one substance and start using another substance. So we know that kids that smoke, 80% of them or 70% of them have tried marijuana. Of the kids who use marijuana, many of them will try a different kind of drug. So I think there are different paths in. I don't think it's necessarily just marijuana, but I do think that as soon as you go past that, you break the barrier and you start getting your brain associated with different chemicals.
I only have less than a minute.
Yeah.
Let me stay on this for the topic of smoking, vaping. Is this an enhanced smoking high that's given that people are, they need more?
So again, all of these substances change the brain. So nicotine is an addiction. I mean, it's an addictive substance, and when you kind of get addicted to nicotine, you have some of the same things that happen
But is
in
it
other
delivering,
addictions.
is vaping delivering nicotine at a higher dosage and quicker?
Yes. So some of these substances, some of these vaping tools deliver a pack of cigarettes in a pod.
The whole
A
pack?
whole, you have a
in
whole pack
one-
of nicotine in one pod of the vape. So yes, you have to really be careful with that because you don't know exactly. It also is unregulated. So we don't know what's in there. We know that people are using some of these things for marijuana. We also know that it can be adulterated. So there are any of, that's why prevention is so really much, is
All
very
right.
important.
We're going to leave it there. We're going to say thank you to Nick Alba and Dr. Carlo Di Clemente. Get some help. You need help. You're watching this. You got a friend. You got a family member. You got a coworker. They need help. Get some help. Don't wait until it's too late. All right, we're going to come back with Liberty University's Dave Bratt, also a good friend of mine for a very long time. We'll be right back.
If you or someone you know is struggling with addiction, reach out to us. We are available 24 hours a day. Visit us online at amatusrecoverycenters.com or call anytime at 833-754-9297.